Thank you. So I'm gonna kick us off by starting with my experience here in the UK. At the moment, we're still in a lockdown, but the good news is that healthcare experts have said that the peak has passed. So right now, it's more of a case of just making sure we're staying at home and we're staying safe. So then the virus can pass easily and we can get back to normal life. Um, I started volunteering for the pandemic by helping my dad. So he is both a vulnerable and elderly person, being over 70 years old and having several health conditions. And while I was helping him, I realized that there were a lot of other vulnerable and elderly, or perhaps both, and they didn't have that help available. So I started posting leaflets where the elderly and vulnerable live in my local area to see if they need help and to see how I can help them. And then I often left like my number and my email on the back so they can contact me with any help that they need. And I've been volunteering for about 1 hour every day where I can. And I've been doing various tasks such as grocery shopping and picking up medication from pharmacies. And this is a totally contactless process. So I will often just like leave the things that they need by their door, and that way there is no risk of virus transmissions. In also the busy areas where I live, I have done dog walking, and that's been really useful for the people who are not able to get out at the moment due to the virus. Some things that we've been doing in the UK is that because the schools have been shut, the teachers have been making face masks and donating them to hospitals. And we've also been drawing rainbows and hanging them up on our windows. And it's been a really fun activity for young children to spot, like when they're on their 1 hour of exercise a day. So those are the things that's been happening in the UK right now. We are going to speak to several people now. We've got a lot of great speakers today. Our first one is Elizaveta Khunduma from Russia. Eliza, are you there?
Yes, can you hear me?
Yes,
I think
yeah, we
I'm
can.
not muted yet, right? Hello, yes, nice to meet you, Rebecca. My name is Elizabeth, and I'm International Projects Coordinators from Medical Volunteers. I actually have a presentation to show you, so give me a moment. Let me just open it, okay?
Okay, sure, no problem.
Okay, wait a moment, please. Okay, so now I will be telling you about what exactly we medical volunteers are doing now according to all this coronavirus situation and everything was happening now. So medical volunteers with several organizations such as Association of Volunteer Centers and All Russian People Front are working on one project named We Are Together. This is the project that organized to help people who are self-isolated, to help people in this coronavirus situation in several areas. So as you see, we already have joint concept and some huge results that we achieved in such a short time. So we organized volunteers headquarters all over Russia, which is 85 regions. And in 85 regions, those headquarters are working in several areas, which I will be telling you about a little bit later. And and in these areas, we help self-isolated people. So as you see from my presentation, we already received more than 2 million calls there are so many people who are ready to volunteer in this project. We already received requests from more than 90,000 people who are willing to volunteer, and we are receiving those requests through the website of the project, which is called mywmeste2020.rf, which is like we are together to 2020.ru. And also we have another option for the offers from some other partners, from like such as just a random person who wants to help, or for example, hello, are you hearing me?
Yeah.
Yes, we can hear you.
Yeah.
Okay.
Yes, we can hear you.
For a moment, I just got scared, like, what if I'm having a microphone
Everyone
problem?
is hearing, everyone.
Yes, okay, so I was saying that we were also receiving other offers from our future partners who are also willing to help as much as they can. Okay, so let me tell you about several areas which we work on in the framework of this project. So first of all, then it's like the main area is purchase and delivery of the essential good. So as you know, a lot of self-isolated people, especially the older ones, they cannot go to buy the groceries by themselves in the shop because they are self-isolated, they are high risk group, and they need help with that. So our volunteers are helping in this area. What we do is we buy the essential goods for those who are self-isolated, for those who are in need, and deliver them to them. We have a special way how all this system is working. So as I told you previously, we formed 85 headquarters in every region of Russia. And we already created a hotline where people who are in need, they are calling us. After that, they are making the application, and this application is being transferred to the headquarters of the region where the person who is in need is living. So after that, the volunteers receiving this application, they are making a final call confirming that this person is waiting for the groceries, this person is waiting for some medicines or else. And after that, we buy those essential goods and deliver to the person who is in need. So in this area, we have a program for the volunteer preparation, for the right volunteer preparation, because as you know, our volunteers, they are having a risk of delivering this groceries. So because of this, we have a way to prepare volunteers, which is mandatory for them to pass. First of all, it's the remote training. So all of those people who are willing to volunteer in this area, they are passing this remote training and informed about sanitary standards for the volunteers, the challenges in working with older people, the actions of volunteers which needs to be done in the emergency situation. The second stage is to have a safety instructions face-to-face. They are coming to the headquarters and they are informed about the safety instructions. So the third stage is receiving your accreditation badge and the access to work. And the last one is actually, we call it like check-in procedure. Is just like a way to start the day. So we are taking the body temperature, at the same time giving the last safety training, and the people are receiving personal equipment, so personal safety equipment. There is some ways to distinguish a true volunteer, which is, as I said, having a special badge. Volunteers are always having their passport, and at the same time, volunteer knows a special number of the beneficiary, the person's, like the number of the application, and the identity of the volunteers might be verified in every headquarter or in every volunteer organization. So, and also all our volunteers are having a personal protective equipment, as I said. So second area is providing help to medical organization. In this area, our volunteers are helping the medical personnel. In this area, volunteers can be only those who already received a medical degree or are on the way to receive a medical degree, which are medical students. So the third one is providing legal support. As you know, during the quarantine, there is so much going on with with everyone actually, and there is so much going on with people who are having their own companies, like little companies, businesses, or some, for example, there are some people who are getting fired because the company cannot afford having them. So we provide a free legal support by online form. So like people are just filling online form and then receiving an answers on their questions. So the second areas are physical assistance, psychological assistance, which is, as you know, a lot of people are seeing so many different information on other websites in the internet. They are panicking. They need help in that. They need to understand what's going on in life. And we are those who are willing to help in this case. So we provide them this assistance through the hotline and also through the chat and Viber. And also the last area while we work in is online help. What we do is our volunteers, they entertain older people, because as you know, now it's a quarantine and most of the people, or like lowly people, they are lowlies, they cannot talk to anyone. So in this case, we are helping them. We are creating some interactions for them. We are talking to them, and this helps them to pass through this difficult time. So as I told you already, the volunteer preparation, here you can see the stages, and also here you can see the website where the volunteers can register. Okay, and the last one is how to distinguish a real volunteer. I already told you about that. So anyways, I don't want to take a lot of time. So what I wanted to say is that in this project, we see that lots of people are together in this situation, and everyone is helping as much as possible. A lot of people, a lot of companies are willing to help. For example, we received cars from Kia Motors. They provided a car so that our volunteers can deliver groceries to people who are in need. Domino's Pizza provided pizza, and for example, there is this company named Faberlic. They provided us with antiseptics. So what I'm trying to say is now the work what we're doing is also by the help of the other companies, other people who are willing to help in this. So in this project, I can see that all of us, we combined our activities, we combined something what we have, and now we are doing this project. We're helping the ones who are in need. Hello?
Yeah, hello?
Yes, hello, we hear it.
Yes.
Hello?
So this is
hearing.
Yes, I think we are hearing you.
Hi. Yes, thank you, Liza. Thank you for everything you had to say. It was really interesting to hear what's going on. Next
Thank
we
you.
have.
I tried to make it as short as I can.
It was really, really good. Thank you. And the presentation was really good with the visuals, helped me picture things. Thank you so much for putting in that effort. And our next speaker is Desli Shahini from Albania.
Hello, how are you? Hello to all. I'm really glad, firstly, that I'm part. Do you hear me?
Yeah.
Okay. Okay. Firstly, I'm really happy, firstly, and glad to meet each of you at this conference. I am a doctor working as a doctor in those difficult times, and it's not only a youth activism for me, but it's even helping as a doctor on those difficult days. But what I feel more to share about is all the activities that I do out of the hospital due to the pandemic situation, and this is even more important for me, not only because what I help in hospital is of course very important, but what we do out of hospital with a lot of young people, it is more giving to us energy and positive vibes that are very important and really interesting to share in this conference. What I do inside the hospital is doing the doctor things and helping a lot of patients that are suffering from coronavirus, but the other things that we do outside of the hospital, it's helping a lot of people not to face the hospital and not to be present in the hospital. And this is very important in this moment because sharing information is caring, and especially in such kind of difficult moments of life when everyone needs to know more about how to get protected. And one of the activities that we do with all the young people that I lead here, it is related with sharing information. First of all, we have started to share information in how not to be part of the virus, so how to protect themselves. In fact, we started this because a lot of women, pregnant women especially, asked me and asked us how to protect themselves. We start with them, so the most vulnerable groups, so pregnant women and then elderly people, and then we continue to share information for all everyone that is like feeling or asking how to protect themselves. We start sharing those kind of information because we know that protection is very important in this moment, and is very important not only helping with those kind of information, but helping with the protection that they can do. So we started with the health tips in how to protect themselves, what to eat, what is the most important thing to do while we stay home, what kind of activities can remain us not only a healthy mind and healthy body. And then after we shared those kind of information, we understood that what we need to do is even sharing medical supplies, especially for elderly people that couldn't go out to get medications or their normal drugs that they take. So the first delivery that we did in those difficult situations was sharing medical supplies and all the medical things that they need. So we bought it from pharmacies, or we get it from the hospital or from the medical centers, and we send it directly to home. While we share those kind of medication supplies or drugs, we even share our information in how to protect themselves and how to be part of this situation. This is not only for medical volunteers, for sure. This is for everyone that can or feel like they can do something, because as we explain to the people, we do like e-meetings where we share such kind of information for everyone that want to help and to do the volunteer. And then those kind of young people share the power with the power of the young, everything, every information and every medical supply or drugs that the people need in their homes. In the first time was firstly because I think that we have to share even our difficulties, because it's going to be helpful for everyone that want to start even from now. This was very interesting because from the first we faced a lot of difficulties in how to even get those kind of tips in how to help the right people, because everyone is panicked, but we have to distinguish the most vulnerable one from the other part of the population, because for sure we can't get in all parts. As long as even here the situation is still in lockdown, so everything and everyone can stay home and should stay home. It is even more difficulty for diabetes, for example, the diabetes people and high blood pressure people, not only with the fear of getting infected, but even with staying home and not doing any activity, because in my country it's still not permitted to go for any activity. Those kind of people, we even started to share some activities that they can do inside home. You know, there are mostly elderly people, but even from 50 nearly, we started to share some different activities that they can do home, because it's very important to keep healthy as long as they are staying inside, and even not to lower their immune system with the stress, because sometimes not sometimes, it is even something that we share with them. It is that as long as our stress is higher, the immune system is lower. For that reason, they had to manage their situation inside home, and they had to manage everything that is related with their health in order to keep healthy as long as they can, because this will help them even to boost their immune system. To continue with, of course, we provided and deliver to them even some groceries for people that are staying alone and even they are facing difficulties in order to go and buy them. But what I find most important is even sharing with them not only the things that they need to eat or to drink or the drugs that they take, but sharing information. I found it was very helpful because I see a lot of people that write to us, to our platform, how helpful they find such kind of information that made their lives even better and changing their routines. This is very important because keeping a normal routine from the time that everything was normal to now is not anytime possible. And people tend all the time, their psychiatry tend all the time that find out of their routine it's something wrong. So they started even to get angry or to get even with a lot of, to face a lot of different situations inside homes. So we started even to share some psychology information in how to protect themselves and to protect their mind, because for sure a healthy mind stays in a healthy body. And for that reason, it's very important to help them with such kind of information and keep their mind busy, and even tell that not following the normal routine is not a wrong one. We have to find a new routine in those difficult times, and creating a new routine for them, starting to advise them in how to create a new routine, a new attitude towards all this kind of situation will be not only helpful for them, for their families, for their staying, and the most important one is even to share such kind of information that will keep them busy, because sometimes even us, for everyone, I know that it's difficult to stay all the time home and to do things from home, to change your sleeping habits, your eating habits, everything. So such kind of information will help not only them, but even us to be more able in order to be near everything. And this is very, very important, because I know that sometimes it's very difficult not to be part of the normal routine, but this is something that will change soon, and we have just to get adapted. I see that someone sent a private message that the routine checkup can be postponed in the age patient plus 60. For that information, I know it's a lot of doctor things, but I'm sure that for everyone can be useful. For everyone that is plus 60, changing routine is very difficult, but is needed. It's very, very needed to change the routine. Why is that? Is because we have to adapt a normal mind to a normal situation. We have to understand and to face that this situation that we are past is not normal, but for our mind is even less normal. For that reason, we have even to face that what is keeping us busy and what keeps our mind busy will help us to have a stronger attitude and a stronger relation and a stronger immune system for sure. Don't forget something, that even young people, we have the possibility to share such kind of infection even with our grandparents or for our parents, for example. I'm working in hospital, and I every day fear to my parents that I can infect them as long as I'm working in hospitals. I'm working with a lot of people and I meet a lot of people. Not meet, of course, respecting the distance and everything else, but for sure it's something that can happen. But what is important is just to be more positive, because I think that I believe that positivity will help a lot people to be even more careful. It is very, very difficult sometimes to keep our mind with positivity in such situation. It's a situation that, for example, in my country, the lockdown is nearly in 2 months. So there are 2 months, 60 days. 60 days, there are a lot, being away from our grandparents, being away from our normal work, from our normal routine. And for sure, this will change something. But don't forget that we say something in medicine that is very important even to keep in mind. Our mind is a wild horse. don't forget this. And we have to train this wild horse to be part of our body. So all the time, don't forget that you have the power, each of us has the power to train our wild horse, that is the mind, in order to help everyone. So I'm sure that everyone will be able and empowered to train their minds in order to be part of understanding this situation and making this situation better. But sharing information and sharing such kind of tips would help even other people. I know that we all the time talk with our friends or with other people around, or even in work, online working, and blah, blah. So everyone that you are going to face, please try to share such kind of information, helpful information, in order to help not only them, but even you, that this situation is something that is going to happen and we have to face it as a normal one. I am just reading now some of the comments that there are downs. So being a practitioner doctor, what do you think that we can grow our immunity power? So as long as firstly, hot weather will not kill the virus for sure.
Sorry, Desli, sorry. It's been 10 minutes. Do you mind if you could just quickly wrap things up so then we can have the other speakers?
Yes, but I'm reading some of, we are going to answer to the other questions after the meeting, or can I answer now?
Yeah. So after everyone has spoken, we're going to answer all the questions in the chat.
Okay, only last sentence. Okay, we are sharing such kind of activities not only to know what is going to happen around the world, but even to practice in your country. So find the power inside you to be you, the one, not only the volunteer, but you, the one that will share such kind of activities in your own countries, because I believe and I know that we young people have the power to change the world.
Thank you so much, Desli. That was really, really kind of nice. Thank you. Our next speaker is MaryJane Nweje. I hope I said that right. I'm trying my best with the names. From Nigeria.
Yes, you said it right, but MaryJane is absent. I think that she had a bad internet connection. So let's move on to the next speaker from Tanzania, and Gabriel Karsan.
Hello?
Yes, we can hear you, Gabriel, please.
Gabriel?
Yes, yes, I can hear you. My microphone was muted. Yeah, so I'm Karsan from Tanzania. First, to start with the case that we're going through, we have about 480 cases, 16 deaths, as well as 167 patients who have recovered. That is the official status, but in reality, people are getting buried every day, and the situation is not as how it seems. So for me, I started volunteering before Corona came to my nation, because, if you see your neighbor going through something, you should prepare. And the first thing that we did is to actually involve the people, to include the people, boosting inclusion through awareness. That is the first thing, because as we deal with the pandemic, we are dealing also with an infodemic, and that's the worst one of all. We are currently not under any form of lockdown, but they're saying maybe we are going to do what they call herd immunity, but herd immunity is not working because people are still dying every day. This calls for people like us, activists and dissidents, to speak up, because it's the first thing. You need to speak up. So as a volunteering opportunity, me and my organization, Internet Voices, the first project that we did is battle the infodemic. And that started by sharing objective truth about the virus. What is the virus, how it can get to you, and as much as it's effective, how can you balance, work-life balance, in a place where you need to protect yourself. Another thing for us young people we did is to instill the message of being morally driven, because we do have a moral responsibility. You might not be on the vulnerable case, but if you get infected, there's a large chance that you might infect someone who might die. So it became very important to share that message. We have partnered with students in Uganda who we are doing webinars now to do as much as we can to raise our voices on our current situations, how our countries are dealing with this, but importantly, how we as the people can spread positive and objective truth towards the virus, because some people are still commuting, no social distancing measures whatsoever, because some governments have been skeptical in sharing the truth. They want to save the economy, but you cannot save an economy where you have to sacrifice lives of the people. Another project that we are doing, we have partnered with our fellows in Ghana, Volunteers Against COVID-19, where the young people actually go to share PPE, face masks, sanitizers to the marginalized groups. You know, we in developing countries, most of our people still live under some economic conditions where they cannot afford these PPEs as well as these sanitations. We do not even have flowing water. So we as young people came together. We were reaching out to donors, and we are looking for support as well. We have been sharing as much as we can. Little we have, sharing PPE as well as this cleansing materials, but also we have been sharing the message that you need to stay at home and flatten the curve, because we have not hit the peak yet. We have not hit the peak in terms of people, and we have not hit the peak in terms of information. So there's some conflicting messages, and I believe there shouldn't be a two-way fall when it comes to truth. People should listen to the health experts, and I'm glad that we have some here. That is the first thing. And follow the rules. That's the only way we can deal with such a pandemic. And now, where this pandemic is very data-driven. So I'm looking forward to collaborations, and let's keep on pushing for the messages, young people, that battle the infodemic first, because the infodemic is deadly. When an idea is properly instilled to the brain, it can be as deadly as the virus itself. Thank you.
Thank you, Gabriel. Thank you. Our next speaker is Moreno Jackson from Suriname. Hi, Moreno. Are you there?
Yes, Rebecca, I'm here. Can you hear me clearly?
Yeah, we can hear you.
Yeah, let me just turn on my video. Okay, yes, I think that you guys can see me now. So good morning, everyone. I'm Moreno Jackson. I'm from Suriname, and I'm actually the founder of ACNO Foundation. It's a NGO, a local NGO that focuses on ensuring that the community is being developed with respect to different sustainable development goals. So also in this spirit of COVID-19, we feel that it is our responsibility to inform our community on like a lower level, because there are a lot of infomercials on the television, but not all the time everyone is really understanding what is happening. So we are like translating it into different local languages for our people. So that's one of the projects that we are doing. And also one of the things that is very important during this COVID-19 pandemic is the mental state of everyone, because I know when it first started, people were just like, okay, it's just another flu, and trying to not accept the fact that it's very serious. So when it started to get more serious, the death toll was rising also in Europe. Then I was receiving a lot of calls because I also do psychology. So I was receiving calls from friends and other persons about they're feeling like all their hard work is going to be lost because their business is turning over. They can't finish school. So they were feeling like, what is happening with my life? So I think that we should not underestimate the mental state. And that's why I started doing Zoom conferences, global conferences also, and streaming it live to Facebook. So other people could also listen and ask questions and, you know, like just have a platform to ventilate on how they are dealing with this pandemic. And I've seen that it really helps a lot. Just like this forum, I see we have 96 participants in the call. Everyone's listening and feeling like, okay, so I'm not the only one dealing with this. And I think that that's a very strong thing that we have to unite together so we can ensure that we are staying informed on what's happening in different countries, what we can learn, that what is working, practical solution, but also what's not working. The actual situation in Suriname is that we have, let me just check it. Yes, so we have 10 positive cases that were tested, and I think we are one of the few countries that managed to keep this virus spread out, because our government started very early to close all the borders. So we have like 10 positive cases, and from those 10 cases, we have one person that actually died, but we also have 7 persons who recovered. So at this moment, we only have 2 persons still in the hospital, and it is said that they will be released maybe within 1 or 2 weeks. So if that happens, then we have no one actually in the hospital from COVID-19. In our country, we also have the elections that will be in 3 weeks, and you know the time from election is a lot of people coming together doing these debates. So we are also hosting, as a volunteer platform, we are hosting online debate sessions for the political parties, so they can still share their message with the audience, with our community, on what they will be doing in their next term. And also we are taking into those sessions, of course, how they are dealing with this COVID-19 situation, and how they will be addressing that within the next term if they will be in office. So those are some kind of things. And the last one, what we are also doing is that we are doing sessions about digital entrepreneurship, because many of our businesses here in Suriname were very traditional. Not a lot of businesses were like really online doing those kind of stuff, and people want to go online but they don't know how it works, they don't know how to advertise their business. So we are also doing sessions with digital based entrepreneurship, and we see that a lot of people are really understanding now the power of social media, where before it was said, you know, the internet is something that's not good, and it's killing the relationship of people. But today we can see that the internet actually connects us in a way as never before. So I think that we should definitely, even after this COVID situation, we should definitely keep this kind of global sessions into account. We can discuss different topics, because we have to be prepared for what is coming. There can be other kind of things in the future, and we should just be one and always try to do our best in our communities to stay as positive as we can, so we can create change. Yes, thank you, Rebecca.
Thank you, Moreno, for that. I think it's really important, yeah, to make sure that we understand that we're not alone in how we're feeling in
Yes.
this time where people might be feeling alone. We have MaryJane back now. So she's our next speaker, MaryJane Nweje from Nigeria. Hello.
Hello.
Hi. Hi, MaryJane.
Can you hear me? Hi.
Yes. We can hear you.
Okay. Sorry, my network has been very sketchy today.
That's okay. Good to have you with us.
Okay. Yeah, I'm glad to be here. Okay. So my name is MaryJane. I'm a medical doctor from Nigeria. Hello, can you guys hear me?
Yeah, yeah, we can hear you.
Oh. Okay, great. Okay, hello.
Yeah, MaryJane, we can hear you great. Please continue.
Okay, great. Oh, right. Okay, so currently the state of the coronavirus in Nigeria, I would say that it has been an exponential rise. I mean, from the time we spoke, like the first conference that we had and up to this point, the cases have, I mean, we have over 1,000 cases right now. And obviously it has spread to several states, most of the states. In fact, there are just 2 states in Nigeria that haven't recorded cases yet. That's Kogi State and Cross River. Most of the other 36 states all have 1 or 2 cases. The epicenter still remains Lagos in Nigeria. So far, well, I would say that the government and the National Center for Disease Control, they're doing the best that they can, you know, with upscaling the testing capacity, because what happened initially was that we didn't have the testing capacity to really say, or how many people do actually have the virus. Do you understand? And over time, you know, following the government efforts, some donations from international organizations and people as well, they've been able to procure more testing kits, and they're testing more people than they were, because, you know, the fact that the virus, I mean, people can be like have the disease and not show symptoms as asymptomatic, right? So that really, you know, affected, or really affects, you know, the number of cases. But when you're able to test several people at the same time, or able to test a lot of people, you know, I mean, you'll be able to ascertain, even if somebody doesn't have the symptom, you can say, okay, this person is either positive or negative following the test results. So with that, we've been able to identify several cases. They are still tracing and doing contact tracing and trying to identify those people that have come in contact with those that have the virus. With volunteer projects, there are a lot of them. I mean, countless volunteer projects going on, because, you know, so they instituted the lockdown, you know, nationwide lockdown in like all the states. And because most Nigerians are they get their daily, like they get money daily from the jobs that they do. Maybe they sell stuff, they sell maybe provisions and things like that. So whatever they get from the daily sales is what they use to feed their families. Now, with the lockdown, most people that have those daily jobs aren't able to do their jobs. So what happened was that we had a lot of people that were at home and then, you know, complaining of hunger and stuff like that. So that really triggered a lot of organizations, even, you know, celebrities and just young people in general, to start up projects, you know, to assist these people with food items, with welfare materials and things like that. So right now, currently, I'm involved in about 4 projects that just function as a form of provision of assistance for you people, you know, around the country that probably need help, that can't afford to feed their families. So what we do is that we get funding from anybody really, and then we buy food materials and then, you know, take them to the communities and deliver them to these people. Now, for me, for the foundation that I founded, because we're more focused on women's health, we are launching a program. In fact, it's supposed to start tomorrow, a project that we would carry out a virtual sexual and reproductive health counseling, because one thing that we noticed is that there are several cases, or there have been increased in number of cases of sexual assault and domestic violence, you know, since, I mean, I think we noticed that it worsened after the lockdown. So usually we'd be able to say, okay, you can come to us, but the fact that we are all on lockdown, people cannot move around anymore. So we decided to create a virtual space. It's called the Safe Haven Project. So it's a virtual platform where anybody that has issues with maybe sexual abuse or domestic violence, or somebody that just wants to maybe counseling concerning sexual reproductive health, something about their sexual health, or they have an issue with, you know, their sexual health, and they're looking for counseling, they're looking for advice, you can just call in or send us a message, and then we'll reach out to you. We're currently handling a case. In fact, I was shuttling between trying to answer this Zoom call and then also like provide assistance to one of our cases, a girl of she's a teenager, and then she's been abused by her father in her own house, and her mother cannot do anything. So in a case like that, obviously the first thing to do is to remove the person or separate the victim from the abuser, and then we're trying to get the police to do that, and then before we can even talk about counseling. So my foundation, what we're doing really is just to provide support for people that have experienced sexual or domestic violence at this time. So that's what we're doing. And so far, I mean, I think it's pretty interesting, and it's something that, you know, young people should really consider, and not just in my country. I'm pretty sure that these cases of sexual abuse and domestic violence, I'm pretty sure if you look in your own different countries, it's probably also rising, because most times abusers are usually at their homes. Like most women that are being abused are probably abused by somebody that maybe lives with them, or a close relative, and some stuff like that. So with the lockdown, most times they probably have to be exposed or spend more time with their abuser. So it's something that we know we should all you know, consider and look into, and see what way we can, you know, assist each other. So yeah, that's a bit of summary.
Thank you for that. It was really interesting hearing the things that you've done with women's health. That's like a really big topic that's close to me as well. Our next speaker is Sue Hanrui from China.
Okay, so can you hear me? Can you hear me clearly?
Yes, we can, thanks.
Okay, I was waiting for the response from Rebecca. So my name is Ruthie. I'm from China. So I'm right now a third-year student in university, and my major is Russian. So I'm really sorry I cannot provide any kind of professional advices like other doctors or nurses or medical students, but I have summarized some volunteer programs and something that I have been involved in. So that is something that everybody can just get involved in, instead of just the medical people, because there are a lot of other people as well, and they also wanted to do something to help. And I have some good news to share, is that in China, we have almost finished this epidemic. And we just got the news today that college students are returning back to university on the 14th of May. So it's like everything. And right now we have, we used to have more than 84,000 positive cases, but now we have only less than 1,000, and they are not in a very serious condition. So I can say that China is doing a pretty good job, and there's maybe something that we can share and to help. But also it's becoming there's one thing that I think worth mentioning, is that there have been more cases without any symptoms in China, and we have been we are not paying too much attention to this, and we are going back to our normal life because we think it has to happen and we can avoid this. And we can say that those cases are without any symptoms because the virus is getting less deadly, but it's getting easier to spread. So it can just exist in the human body for a longer time, so that it can spread to other people as well. So it's like it's not that serious the situation, and you should be positive because we have already set a good example, and we can all just overcome this situation. So as a Russian major student, there's very less that I can do, but I do have been involved in a few voluntary programs. The first is I have started activity called Good Morning for Good Night. It does some people who also speak Russian in our faculty, our university, and we wanted to just do something to mentally support those people in Russia who experiencing a very difficult time, especially today. You have more than 7,000 cases. So we were trying to send messages with good morning to those Russian people, and just let them know that we have all been there and we have overcome, and you can all do the same thing as well. And we can share some things that happen in our daily life, so that people can just get inspired and say, okay, somebody's caring for me, and they're sharing some very happy news from their lives, and we can all do this together. And this is something that I have been doing, and I have received quite positive responses, and people were getting pretty grateful, and some of them just started talking with me, and I can say that's how they felt better by talking with Chinese volunteers who try their best to speak Russian, and that is something that makes me very happy. And also we have been teaching some Russian people Chinese, and also we gather materials of volunteer projects in China, and I also listen to different conferences so that I can gather the opinions of many people, and I can share them with different people as well. And we have also translated a few documents in the very beginning, because China first got handled this epidemic, and we try to translate a few medical documents or other things that we think can help people in the different part of the world. We can help them and be translating, and we sent emails with those documents to different people. And also the last thing we have been doing recently, especially, is the I know some of you have heard the discrimination about China, and they say that it's our virus and we should pay, we should compensate, and something like that. And we have, well, there may be a few reasons why this happens, but for those people who just the government and the officials say those things, and I believe it's something that our government should handle. But also, if something on social media says, it's like some fake news and some not true statement about China, and I think it's not those people's fault, because they don't know the truth, and they are so Chinese people are not that bad, and I have already got some responses, and they're pretty good. These are the programs I have been involved in, and here there are some projects I have heard in China. We have I have separated this into offline and online. For the offline, it's basically in Wuhan, in those places, and we have donors who prepare foods and coffees and deliver them to the hospitals, and we can also donate food and help. There are people who go and help distribute and dispatch those foods. And also we have very kind flower shop owners who deliver flowers to the hospitals as well. And there was like a very positive encouragement for those medical people, for those doctors and nurses. And we have drivers who live in Wuhan, and they would drive the doctors and nurses to work and back home, because the city is in lockdown and it's very inconvenient for the doctors to go to work and come back. And we have the people who ride bicycles, and they have the group chat and say who needs something, and they would go travel from city to city and just to buy the things and deliver to their homes. And we have community workers who also make a list of the needs of citizens and the people who live in the neighborhood. And we call this last kilometer delivery, because basically all those logistics can only deliver to the stations. And for those people who are really like older people or disabled people, they cannot, it is impossible for them to go to the station and to come back, even though it's only 1 kilometer. So we have those community workers who do the 1 kilometer delivery. So they would deliver directly to our homes. And also recently we have the volunteers who wanted to take the vaccines. And because our researchers are right now inventing or doing research on the vaccines, and we need people to test them. And people in Wuhan, some of them, and they are already volunteering to test the vaccines. And online things I have gathered from those conferences I have been listening is that because some of the doctors, they work overtime in the hospitals, and their children, there's nobody to take care of their children, and they have also got some problems in the studies. So we have college students who do work as the tutors to teach those kids whose parents are doctors and nurses, and to keep them company as well. And we have already also launched a program called My Day in Those Hard Times, and it's like everybody can write a story of how you spend the day, because you know, if we are in university or in schools, and every day we almost do exactly the same thing. But right now we are at home, so we have our own unique ways, and we can spend our time just very differently. So we decided to share those very interesting stories, very personal or unique stories, and they would read the stories or read a diary of the daily work or daily life. And some of them we help them read that in Russian, and we help them correct the mistakes. And also, if they want, we can just publish them on the social media if they like. So it's like very interesting for other people to read as well. And for those elderly people living alone, we have got some organizations. We have some professional psychologists who would handle those, like, I think it's basically the same thing, like in other speakers have mentioned. You can call and they would call back, or they would give you a 30 minutes call every day to check your psychological conditions. And especially for those elderly people who live alone, because they are experiencing those kind of panic, like more than everybody else. So we have professional people who call them every day in a specific time and talk with them for 30 minutes to make sure everything's fine. And also I have got this idea from a Japanese organization. What they do is that they invite people to write letters and then scan them and in the form of PDF. Then volunteers will print them out and try to deliver them to those elderly people who live alone. So it's like just giving them actual letters instead of typed messages will make them feel cared more. And we have also got a few online entertainment for people as well. It's like we have a different group chats, so people can share different very interesting things in the group chat, so that people will feel, well, it's not so boring at home. And we can make and sticking this to this habit, so it will be easier for you to keep doing this. And since everybody's also with you, you'll feel like you are a team, you're united. So, and also people are supervising on you if you are being lazy or you just don't want to do this, and people will say, we're all sticking up to this and you should just join us and do sport.
Hi Sue, I think that the connection is going. Hello? Sue, are you there?
Can you hear me?
Yeah, sorry, the connection was going there, but we have to move on, I'm afraid, because there's just not that much time available. Sorry.
Okay, I have only got 2 points to mention. So it's like,
yeah,
okay,
sure.
Only one. Okay, so it's like we have got good news every day. It's like basically people just share something interesting or something good in their lives so that people will get and having and actually what is one interested in. So you can just raise questions and I'll try my very best to answer them. Okay.
Thank you so much. Thank you for sharing the experience in China. It was really insightful. Thank you. I really appreciate it. So our next speaker is Walid Kadroy from Egypt. Hello, are you there? Walid?
Maybe we should go back to him in a little bit of some time. Let's move on to Omar. Rebecca, what do you say?
Yeah, sure. Yeah. So we'll move on then. So our next speaker is Omar Elbarbary from Egypt.
Yes. Good morning here in Egypt. We are in the morning. Omar Elbarbary from Egypt. I'm the managing director of the OPM Egypt. Is the first platform here in Egypt for the young and student before 8 years. Egypt have a different situation about the COVID. We are witnessing strange economic growth in Egyptian exports. Our economy is rise for 2% yesterday of export of food products. There are many organizations here in Egypt that have made calls for young people or for youth and for students to help them with hospital. For the medical solutions of patients and for helping the patients on the hospital of COVID. We have here about 34 hospital for COVID-19, especially made for COVID-19 here in Egypt. Some of the students at the Faculty of Medicine have been invited by the Egyptian Ministry of Health to do the doctors what they do. Here, all the youth and voluntary in organization inside the Egyptian governments carry out awareness campaign through the online campaign or the offline campaign. We have many online campaigns because Egyptian is not have many knowledge for using internet and the solutions of the new technology, but here we have many knowledge and the old people here have knowledge and access the online campaigns and awareness. I think the awareness is good for me now, but we have many people going to the street. Can't work from home. This is the first time here in Egypt for my porn to be here in work with online work. This is very difficult for us here in Egypt, I think. But the loss here falls on the small startups. But there was a solution that an electronic and online platform was created to display all the service of companies in online platform. Many of education organization here is going to be online. This is organization before 1 year, or sorry, for 5 months. 5 months. We don't know this is organization. We don't know how to use the course or how to attend the course on the online or the Zoom or the online platforms. But I see that exciting education initiatives in Egypt through the online, it has now witnessed a growth in each shares in the Egyptian market. Let me tell you, many Egyptian parents of students were preferring against online education for this is they do it before 3 months here in Egypt for the Ministry of Education. But about the volunteering here, we have a great volunteers here going to the hospital, going to the poor people. We have packages for the poor people in many cities in Egypt. I'm very proud of my country, youth of my country in the Middle East. I think we are the first here for going to do the voluntary subjects or things here. Thank you. Hola.
Thank you, Omar. Thank you. We're going to try and go back to Walid now. Hopefully he's ready for us.
I hear you now.
Hi.
Hi everybody. I will. You hear me now?
Yes, dear, we do hear you. Please go on.
Yes. My point, I want to concern about the coronavirus related to after coronavirus pandemic. Any researches found it for a couple of days away. Speaking about the pandemic will be finished end of May in some countries, and in some countries in June, and also in July. Like many, we are struggling to comprehend that new world we will find ourselves in. I can see publishing research and news about emerging infection diseases like coronavirus. Compared to what so many are experiencing, the impact on nature has been relatively small. From the history, as a country introduced measure and can measure to stem the spread of new coronavirus, one of the most alarming conclusion from infection the modeling is that there is no clear exit strategy. We can see from China and South Korea, for example, how a combination of community surveillance, testing, and contact tracking and tracing, strong social distance, and rapid clinical care reduce infection. But we don't know how long this measure should be last, or what is relaxing them will allow the virus to be regenerated. My last point I want to sharing with the people is economics is most important than coronavirus, because all of countries maybe 1 month, 2 months will be back to life, and everybody itself must be taken care, and just alone, not as a company, not as a government. And I think so it is very dangerous in will be affected in people until we found medical or clinical end of this year, maybe as most of researchers said in December end of this year. And from now to end of this year, I think so must be take a responsibility as alone, not as a government. Because I am totally agree with the life must be back. because it is a lot of affected people and the economics and the government and everything. This is my little point I want to sharing with you guys, and thank you.
Thank you, Walid, for sharing. We now have Sara Rajabli from Azerbaijan, and I think you are going to be showing a presentation.
Yes. Hi to everyone from Azerbaijan. Thank you very much for invitation for this conference. Actually, I would like also to share some information about our initiatives. So in Azerbaijan, actually during COVID crisis, I saw a lot of young people who have been involved in different charity activities. They fundraised a lot of money to buy some products for poor people, for family in need who lost their jobs, who have been dependent on their daily jobs. It was great activities, of course. It shows the huge empathy of our young people, but this is not sustainable. And actually, during COVID crisis, we should think about the new approaches of capitalism, of new approaches of building our business models. So actually, we started to launch the online mentorship program on social entrepreneurship, which became the biggest online mentorship program in our country. This idea came during this COVID crisis after observing different charity activities. And we even didn't know that after approaching so many people around our networks to reach much more rural regions in our country. This idea was started with a zero budget, which is started to notice in our notebooks, and we started to approach different people in our networks, and we decided to connect those top professionals from our country and also from other countries with rural young people, with female entrepreneurs from rural regions, and also with refugees as well. So why actually we started this project? Because we saw that our young people, they're only thinking about charity in solutions of social problems. They see around themselves a lot of problems. They see a lot of poor people who suffer a lot during crisis, but they are not thinking about changing their perceptions and approaches. So we decided to launch this mentorship project in order to connect those young people who have the social business ideas with top professionals who would guide them to implement in a right way, to implement in a much quicker way, with the right approaches as well. So we decided to launch the structured mentorship program, as in my own experience, we saw that when you don't make it any structure or discipline for your mentorship project, neither mentor, neither mentor could get any results. So it was so important for us to put some rules, to put structure and deadlines in order to make this process very effective. So we decided to launch the 3 months online mentorship program where mentors could dedicate their time for free for rural young people, for women and refugee entrepreneurs as well. And for now, actually, we have more than 40 mentors from more than 10 countries. We couldn't even imagine that in less than 1 week we could enroll for our project, which is raised, which has been implemented on volunteer basis. We didn't get any funding or sponsorship for this project. It was just purely on enthusiasm and passion of our team members. And we could also, through partnership with local and international NGOs, we could also involve more than 70 mentees who are mainly, as I mentioned, rural youth, teenagers, women, and refugees. In Azerbaijan, we have refugees from different countries. So our legislation doesn't allow them to work legally. So for them, small businesses is the most effective way to sustain their own families as well. And we also have these 17 mentees from more than 20 regions of Azerbaijan. And we got, when we calculated all the value of time of our mentors, we saw that actually more than $450,000 they did in kind support of delivering the mentorship service for free. So it was a great value for our young people as well. And also when we launched this social business online mentorship program, we couldn't even imagine that we could be a part of global communities as well. So a lot of international organizations, they became our partners. So One Young World, which is also very famous for organizing the biggest summits around the world in different locations. And Unison Youth, this is a fellowship program for social entrepreneurs who want to accelerate their social impact, became our main supporters. And also we got a lot of mentors thanks to these networks as well. And also our biggest supporter in our local community is the NGO called United Aid for Azerbaijan, WAPA, which has the offices in more than 50 regions of Azerbaijan. And this NGO helped us a lot in gathering this message. So it was also very fruitful for us to get this collaboration. And actually what we have learned from this project is that there are a lot of people during this COVID crisis who want to help. Really, they want to share their experiences even for free, even if they have some difficulties in their enterprises and in their businesses. But it doesn't mean that you shouldn't ask for help. There will be always a lot of people who will share their experiences and resources for free during this challenging time. So it was the biggest lesson we got during this online mentorship program, and it will develop until the end of July, and we will see already the full impact of this mentorship program. We already saw some results, small results of the first steps of our mentees, and we are proud that just with one simple idea during this COVID crisis, we understood that it's not necessarily to leave your house or to have like millions of dollars of budget in order to impact on your communities. It's also enough to have one simple idea with the smaller steps to impact on your people as well. So thank you very much for your attention. Here are our contacts. So if you have any questions, you are always free to ask them, and we will be much pleasure to answer them. Thank you so much.
Thank you, Sara. Thank you for sharing. Thank you.
Thank you.
Our next speaker is Qaiser Nawab from Pakistan.
Hello.
Hi, Qaiser.
Hi, can you hear me?
Yeah, we can hear you.
Okay, let me first of all just formally thank the organizers, the future team, and all those who are volunteered in organizing this whole beautiful conference seminar where we are sharing our experiences and we are learning from each other. And I will give a short presentation, and let me just fix. Can you see my presentation?
Yes, we can.
Good. So let me introduce my first, the organization which I am presenting. It's the Society Together for Health and Education. It's a youth-led organization which is established in 2014 in Pakistan and Afghanistan with some other chapters as well globally. Our mission is to support the young people in realizing their aspirations, dreams, and potential for materializing health and education for sustainable development. We do youth advocacy and development, focusing on youth development. We promote and strengthen democracy by youth participation in politics. And we promote youth volunteerism, interfaith, climate change. We also promote youth entrepreneurship, youth and women empowerment, and person with disabilities with a special focus on gender minorities. This is what we do. Here you can see the logo in the end, which is the form of a book and a life. So we constitutes health and education, and we focus on sustainable development goals. Now coming towards Pakistan. Pakistan is located in the South Asia with a huge population in the top 10, around 220 million people, and it's a nuclear power, and we have in a neighborhood, we have China, which was firstly infected by virus, and then we have Afghanistan, and then we have Iran, which was the severe case as well. And at the other end, we have India as well. So the total confirmed cases since today is 16,117, where total death today is unfortunately 358 people. And now the recovered phases is 4105, like almost 4,000 people are recovered and discharged from the hospitals and the quarantine centers. Now, what is the slogan of the government and how government is motivating it? I should spread a little light on that. Like there is written something in the national language, it's Urdu. That's mean that we have to fight with the corona. We don't have to fear from the corona. And this is the official government website where you can get the latest information. You can get the safety precautions. You can register yourself as well. And now, what government has recently did, just as a relief to the government, to the people, is that for the first time in the history of Pakistan, the government has introduced the online classes through television, through national televisions. For kids, they introduced a special entertainment programs, and beside this, they gave a huge relief in the form of money for every those who are daily wagers, those who are deserving, in a form of cash. And beside this, they already like work from home initiative as well, and you can now like work from home. Like it's totally depend upon you, either you want to go to office or not. So these are some of the initiatives that is done by the government. Schools and colleges are totally off till May, and online classes is and currently going on. Now, how I started and how our organization started work for this is volunteering for this COVID-19 emergency. We were traveling to Kazan, Russia in February 2020. That was the early phases of the virus, where I see in Istanbul airport that there was a lot of passengers who were just like having a stigmatizing kind of attitude towards Chinese fellow passenger. At that time, the virus was initially spread in Wuhan. There was no other cases around the world. So when I see when the group of the young people with me, they also observe that like how just a disease can change the behavior of a human being towards other fellow human being. So that was totally discouraging for me personally. And then we start thinking that how the young people can contribute towards this. This is totally discriminatory behavior towards Chinese people on airports, on even where we were going, there was International Congress on Rural Youth. I found there was no Chinese youth participating in the forum. So when I asked the organizer that why there is no Chinese youth, they just simply replied because of Corona. So this was totally like a thought provoking for me, that how now young people can help the situation, and how we can decrease the discriminatory behavior, the stigmatizing situation, is because the COVID-19 is like just a new disease. It's understandable that its sudden emergence and spread have caused confusion, anxiety, fear among the general public. So these are the factors that are promoting negative stereotypes and stigmas. And these stigmas and stereotypes are actually one of the big threat for its spread, because due to the discriminatory behavior, the person who is infected, he don't want to come into the public, he don't want to show himself. And at the same time, there is like no proper health, and there were a lot of discouraging behavior towards the patients. So then we launched a COVID-19 Youth Task Force, which was focused on sustainable development goals with the mind that like what will be the future of the SDGs, what will be the future of the world after, in post-corona world. So we put this together with some of the other youth organization, and we formed this proper campaign, a global campaign with chapters worldwide. So here what we did is we initially formed some of the objectives, which was the like consortium of youth organization, regional, national, and international. Like those organizations, young people, youth organizations who are working regionally, nationally, or internationally, they should combine together all of their work. That what, like let's say some people they need a food, and when one youth organization go, they help them with their food. The same time, the another youth organization also go to the same place. So there is a confusion between who is the most desirable and who is the most like vulnerable at this time. So there was a need of proper networking and proper platform. And then the other objective was that we need to engage the youth to spread awareness regarding the prevention of COVID-19 and local and sign languages. So like WHO is giving us some of the different kind of instructions, some of the safety measures, but this is only in English or probably in French or some major languages. But if I just give you example of Pakistan, we have 56, around 50 local languages, like regional languages. So most of the people don't have that much understanding towards the international languages like English, like French or some other. So what we did is the young people translate these messages, these awareness kind of instructions into the regional and local languages. Another kind was that to help the disabled, the special people, the special person, the person with disability. So we translate them into the sign languages as well. And the third major objective was to motivating and helping people who are in quarantine by various creative activities. Like just two weeks ago, one of my friend who is a doctor, he's a young man, he got his test positive, unfortunately, and I just speak to him on a call and for even hours and hours just to give him motivation and to also get some information as well, that what kind of the symptoms, how was the situation, how you feel it, and what is your morale as well. So this is what we do, is like to 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 higher the morale of the people who are already facing this pandemic diseases. Now the fourth one was that supporting people who have no access to livelihood, like transgender community in Pakistan, like gender minorities are around the world, like widows, orphans, pregnant women, senior citizens, and again, person with disabilities. So we, the young people, we mobilize the young people and we help these vulnerable and these people of the community, like transgender, widows, orphans, and providing them food rations voluntarily through charities, through different means, and to help them in buying, like, let's say, grocery and other stuff as well. Now the fifth one was like an online education and entertainment programs for kids and elder citizens. We did this activity in UK. It was very successful, that we connect the young people with the elder people or the elder citizens through phone call, through WhatsApp call, through video call, and we take the benefit of the time to get the experiences from their life and from their jobs and from their retirement. So what we did is we actually engage a two-way communication. Like we engage the young people who are sitting idle, who are doing nothing in the houses, now lockdown, who are fully frustrated, who are fully in depression, and we engage them with those people who are elderly citizens who lost their morals and who are more effective, who are like more into this. So there was like a two-way communication, and that was very successful as well. And then we did is like developing community-based guidelines and global campaigns to threat the effects of stigma on the people and COVID-19 responses. So these were some of the objectives initially, and we are open into it. And we would when I have a session with the young people, we just pen down one of the creative things like painting competitions, like other arts competitions. Just one of the speakers suggested that we have online speeches for the election campaign, which was really an innovative idea for me. Like even democracy is again strengthened by such innovative and modern techniques as well. So here are some of the our leaders around the world. We have young people from Afghanistan, from Serbia, from India, from Kenya, and you can say that this is from Balkan regions, from Uganda. This corner one is a transgender person who is working with us voluntarily in Pakistan. She is the chairperson of the whole force as well. And we have from Romania, again, you can see some Cameroon and Botswana, and we have a lot of people from there. Just to cut it short, like we have people from 4 continents, and the total sum of the youth which are engaged is almost reaching towards 50,000. Now what we did is we write down to different newspapers, we write down our stories, we connect the young people with the newspapers, magazines, youth magazines, and bloggers, And here you can see that the Danish newspaper Politiken just shared our initiatives. Then we just had a webinars with time to time, and we spread the awareness in different languages and different form of. Here you can see some of the work from or Africa. There you can see that this is a small town in Cameroon where our young volunteers, they just put simply like a water with the soap as well, and to spread awareness among the community. Here you can see some of the people of the villages. They are telling them about the social distancing, about the utilization of mask, about staying into the home as well. Here are some of the.
Sorry, it's been 10 minutes. Do you have any last kind of comments that you can add?
I would like to take 2 more minutes if you have.
Yeah.
Okay, this is some of the pictures from Azerbaijan where people are, where young volunteers are distributing food materials. And here you can see the transgender community in Pakistan. And the most innovative thing which we did is like we distributed the food materials in night time just to avoid the social distancing matter. We distributed these all food materials among the deserving into night time. Here we wrote some letters to the head of states. Here is the letter to the president of Russian Federation and Prime Minister of Denmark. And there are some of the sympathies messages which is published in Chinese newspapers, in the youth newspaper. In the corner you can see or representative talking to the radio. Here is another thing we did is we marked the social distancing circles in front of general stores, grocery shops, supermarkets, and also with some of the materials which is like if you have vitamin C, then you can have a good metabolism system, etc. Here are some of the other pictures, and yes, this is what we get it in return. That yesterday I received a letter from Germany through German embassy, and the other one we got a letter from Denmark as the appreciation letter, the support letter, and here we got a letter from Romania. At the same time, we got 10 and 11 more letters as well. Just because of the time, I'm not going to share it. So again, thank you very much for listening me. Here is the time to take a screenshot of if somebody wants to share their experiences, somebody have suggestions, and thank you very much, Rebecca.
Thank you, Qaiser. Thank you for sharing your experience in Pakistan. Thank you. I appreciate that. And we have our last speaker now. Our last speaker is Anita Tesa from Indonesia.
Hello, can everyone hear me?
Yeah, we can hear you.
Okay, sure. So as I'm the last speaker, I hope everyone's still awake. So it's a good evening from Indonesia. It's currently 10 p.m. here. So yeah, I'm going to just go to the point. I want to share some presentation. Okay. Okay, here we go. Here is the current pandemic situation in Indonesia as of 30 April 2020. The government of the Republic of Indonesia has reported that there are 9,771 persons with confirmed COVID-19, and also there have been 784 deaths, unfortunately, related to COVID-19 reported. And the last one is 1,391 patients have recovered from the disease. So it's actually quite a big number here in Indonesia, because the government seems not really prepared for this big disaster, because as we have like 260 million citizenship around Indonesia, it's a very big responsibility for the government to tackle this issue. And then about volunteer project in general, basically all of the sector, public sector, private sector, and third sector NGOs are hand in hand doing their job to solve all problems in Indonesia, specifically in Jakarta, because Jakarta, our capital city, is the highest number of people infected. And talking about my volunteering project carried by my own social community, my social community actually called Garis Tawa. So we provide medical equipment. As you can see over here, I give you 2 pictures. So a friend of mine, a doctor in a private hospital, texted me that he needed medical equipment because the corona patients are actually keep coming in. Meanwhile, there are lack of medical equipment such as masks and also gloves and also hand sanitizers. And then they're going to be very they don't think they need to wait for the government to supply them those medical equipment, so they tend to just ask for others to help them out. So yeah, we provide them this supply. And then the second program is actually still going on until now, because we aim to provide free meals for less fortunate people who couldn't work from home. There are a lot of them here, especially in Jakarta. So yeah, that's actually all basically, but I think I'm going to share another one a little bit. Wait a minute. Can you guys see? Hello? Hello?
Hi, yes, we can hear you. Go ahead.
Okay, I think something error happens here, but basically, those are 2 programs that run by my organization. So basically, Garis Tawa, my community is focusing on fulfilling primary needs like education and also meals, free meals, and also houses for homeless people. But this current condition forced us to do something more as a reactive action towards COVID-19. So yeah, not only those regular action, we also provide some medical equipment for doctors and all medical frontliner, and also free meals for those who cannot afford to buy meals or food for their daily life. So I think that's all. Thank you.
Thank you, Wine, for sharing your experience. So that's all our speakers for today. I just want to say a massive thank you to everyone who spoke and shared their experience. And I wanted to say thank you to everyone in the World Future Team organization for setting up this conference and taking the time out of their day to make sure that we've all had a really good experience. And I hope everyone's found this useful and you've picked up some new ideas on how you can contribute positively to society and volunteer during the pandemic. We're gonna now open up the conference to questions. I think that there was somebody who wanted to speak. I think it was Dada who wanted to share their experience. So I'm not sure if we
Hello,
can...
Rebecca.
Hello?
Can you hear me? Yeah?
Yes, yeah. Hi.
Hi, Rebecca. I don't know if the network is here. Can you hear me, everybody?
Yeah, we can hear you. Go ahead, please.
Okay. Thank you first for sharing my experience. I'm Ghada Kadik. I'm a medical doctor from Libya, especially Benghazi city, Libya. First, we know that post-traumatic syndrome is a mental health condition, and in our Libyan people here, we have 2 traumatic, which is a war, the complications of the war in the Libya, also the coronavirus.
The people with it during this pandemic event come to us with upsetting dreams and nightmares, also severe emotional distress with a high degree of domestic violence and also a diverse. This is, we concluded by an hotline call. Everyone can have a call in their home and tell us their feelings, and we provide them with a good solution and put them on the online focus group, which is in a group therapy. We survey more than 500 patients at their home each day since the quarantine started. Also, I'm a debater according to the British Council, and we share our Libyan people all information scientifically and educated about the COVID-19 by online debating between all cities of Libya. We are providing our psychiatric, how can I see, it's psychological cases. It's this trauma is not it's not an easy. So our team do a group therapy online that helps the individual that develop the PTSD, especially the young, very young people and very old people, because these two age groups can infected very easily with COVID-19 due to their physiological low immunity. Plus, the stress also decreases the immunity due to the higher cortisol. So this group therapy or focus online therapy allows individual to develop self-awareness by listening to their to others with a similar issues. And this project is under supervision of the Ministry of the Social Affairs. Thank you a lot for sharing my experience, and I'm very interested with this meeting. Thank you all.
Thank you so much, Garda. Thank you. Thank you for sharing. So we're going to go with the people who have raised their hands next. So I'm going to start with Diane Batty.
Yes, hello. My name is Diane.
Right, sorry.
Oh, it's okay. My name is Diane Bahati from Rwanda. I present the NGO called Rwanda Youth for Climate Action. So I'm gonna talking about the situation in Rwanda now. So we have the statistic from 24th to 19th. We have 71 cases, and we have 1992 recovered. So I can see realize that all those cases come from the truck driver, from those people bring us the food from Kenya or Tanzania, because in our country now we don't have any cases. I can say for the people staying in Rwanda, there is no cases. The cases we have is only for those people who drive trucks from those countries. So I can see we need to continue to respect the law government. As a youth, you can see the youth from my country, they don't respect it, but they need to understand if the pandemic is very bad, it's very bad. We need to respect it, and we need to know if it's not, it's very we can get it. Anyone can get it. They think it's only for the old people. It's not for the old people. You can affect it for the young people. Anyone can be affected for it. So we need to respect the role government. They're telling us. Here's what I can say. Thank you for the invitation. Hello.
Thank you, Diane, for sharing.
Yeah.
Can we go to Menez Akram now?
I'm a lecturer in a university, and beside this, I'm working as a journalist. And I would like to share my experience with all of you that before I start, because time is short, Qaiser Nawab has, I think, covered very well about the introduction, what is going to happen in Pakistan. But one thing I observe, that is the basic issue, that we have to find the real people who are really needy into the region. That is the major concern. And what I did in this quarantine period, I worked for the patient of thalassemia because I'm lecturer, and with the students of pharmacy, I worked for the Sundus Foundation, who is working for the thalassemia patients. And I tried to convince my many students who are the basic source of blood for donating the blood for those students, for those patients. And I tried to convince them to come out from their homes and come out from their homes and go and donate the bloods to them. And I think in this way we can all motivate in our the people who are in our domains. So thank you so much. I would like I want to share this experience with all of you. Thanks.
Thank you. Thank you for sharing. Can we now please speak to Mohammed Al-Anqib?
So, hello everyone. I'm Muhammad from Iraq. I am representing Kokar Foundation for volunteering on SDG goals. And I just wanted to add some more information to the conference as a speaker and trainer in volunteering sessions. So for volunteering work and under this pressure, like for our situation, we need to protect ourselves first, then to go to the field. Because if you not have the level of professional work as a volunteer, you will put other lives in the risk. So you need to protect yourself first and take the all information from the WHO organization for how to protect yourself, as example, using the mask and gloves. And the other things, like we mostly now, like in my organization, working online to supporting the United Nations volunteer program and online, and they have a lot of tasks. Like I think most of you, they will be excited to join to this program, and I will share the link in the chatting. So like if you are interested to get more experience and get in touch with others, so this is the time, because all of us like in the quarantine situation, and mostly it's dangerous when you work in outside the field, because if you not have all the experience and all the information, it will be not necessary to send the help, because you will put the families, the people that you want to help them in risk. Because if you not have the correct information, don't do it. Like it's just advice for everyone. Thank you so much.
Thank you. And then the final person is the Lumineers.
Hello.
Hi.
Can you hear me?
Yeah, we can hear you.
I hope you're safe home and that you're attending this event from home, safe and healthy. I'm Dunya, I'm from Montenegro, and we didn't have cases of coronavirus for 5 days in a row, and the government decided to slow down the measures. But after that, we had new cases of coronavirus, and we don't know how to slow it down. Is that helpful? That measures slow it down, or we should like just stay home and healthy, and help the others? I don't know if you understand me. But from your experience, from your country, did your country had the situation like Montenegro, that it didn't have cases of coronavirus for some days and then appear that? And what did people do in your country? I'm just interested, because here people don't respect the measures, and as a volunteer, I'm really frustrated about it.
Rebecca, if
Yeah,
you allow
question.
me to step
Yeah.
in and to
Yeah.
answer Dunia's question, just briefly from the point of view of a volunteer in Russia. Well, I believe that people are sometimes not respective to the measures because they just aren't, well, reasonable enough. And that is why government has to take the harsh methods, and it is just the only way to keep people safe. And if the government doesn't isn't able to like really do the measures strict enough, then the cases will just be growing again and again. And I think that we as volunteers can do our best, like just telling people that they really need to respect the measures. But we're no government, we are just people. So in my personal opinion, it is never going to work unless the government like makes it very strict. But I hope that in your country, maybe people are more reasonable than in Russia. So I really do hope that everything will be good.
Thank you for sharing. So I'm just looking back through the chat at people's questions. So we had one, somebody asked Sue a question, and even though they've left the chat, perhaps it's useful to answer it because this is recorded, so that person may go and watch the recording later. So did you want to answer that, Sue?
I'm sorry, who are you asking?
I was asking Sue, there was a question about China mistreating Black people.
Rudy,
so I don't know.
Valia, are you on for answering?
Can I
Yeah,
answer
I'm
the...
here.
Okay,
It's like I just actually I phoned my friend to know more about the details because I am not in Guangzhou. I don't really know for sure how the thing was going on, and I asked the details and I know what it was and how it happened. Basically, there are some videos concerning the Black people and the maltreating those Black people, and they are not taken in China, right? And some of them they were speaking in completely different language, and probably you see that some Black people are being maltreated, and you see the yellow race people are doing this kind of things, and you think it's Chinese people doing it. So there may be some mistakes in the social media that say we have been racist and we have been unfairly treating those Black people, but those social medias are also being racism towards us because not all the things are done by China. And also concerning this case, I asked my friends in Guangzhou, and she said how it happened. I'll just tell you the thing is that in China we had a very, very strict laws that it's not a law, but it's like a regulation that we have to wear masks. If you do not wear masks and you go out and people will come to you and you still refuse to wear masks, you'll be arrested. And it's not only for the Black people, but also for Chinese people as well. And so I think everybody agrees to these principles that you are in this kind of country, no matter you're a foreigner or you are the local people, we all follow the same rules, right? Nobody has the kind of privilege. And if you break the rules, and we will treat you just like we treat local people as well. And for those two people who broke the rules is that for Chinese people who come to China from abroad, and those people need to be have a 2-week quarantine in the hotels. It's like together. But for can before go out to a restaurant and then got many people infected. because those people are in the restaurant. If they have own, they're also doing the wrong thing because they should not be gathering in the restaurant. But this is how it happened. So it got infectious, and those two rule breakers spread this virus to some people as well. And then there was also one. And
Hello? Sorry, I think the internet connection is going.
Okay, so can you hear me?
Yes, yeah, we
Can you
can.
hear me? Okay, I think I'm running low battery. I'll just get my charger. I'll keep talking. And then what happened is that those people, they really broke the rules and they are wrong in the beginning. So I think what China has done, the right thing that our country has done is that we have been punishing those rule breakers just as we punish Chinese people. But there come another regulation is that all those house renters have to make sure that they have rented the house to the responsible people. Is that if the people who rent your house break the rules, and you will be in charge of this as well, you'll be punished as well. So some Chinese house owners started to panic because those two people, they happen to be Black, and those people who rent their houses to Black people, they just let the Black people get away. So I can say, I can admit the fact that there exists some kind of racism. Yes, we do. But it's just, I think the mistake that we have made is that we are letting one or two people to represent the whole group. Maybe there's one or two people who broke the rules, and there are 100 people in this community, and we are considering them as enemies as well. So there's something that we have done wrong, and we have been trying very best to make up for this, and we have come up with some kind of regulations as well, and we are trying to tell people that those people are only the minority, and we should just treat other people as well. And basically, these are the things I got from my friends in Guangzhou, and there may be some other cultural reasons. Is that in China we really rare to see Black people here, and also people get frightened if Black people just go and gather. For example, I don't know if this is a stereotype or not, but people in Africa or Black people, they have the habit of gathering and living together. Is that true? I don't know, but in China that is how they say this.
Sorry, I think we have to move on to the other questions. Could you perhaps say like one last sentence on?
Okay. People get threatened, and that is there's a difference between official statement and the statement between common people. So maybe our people haven't seen too much Black people gathering together, and they get threatened. So if this is our fault, I do apologize for our country, but please believe me that Chinese people have no attitude or no prejudice to any foreigners in China.
Thank you so much. Thank you for sharing that. I see a question here about asking about the 2% increase in exports, and I'm not sure if there is anyone who can answer that. Perhaps if you raised your hand, if you can answer.
An economic question. I think it's not the topic of our discussion today, so there are no experts in economics. And by the way, Rebecca,
okay.
I was chatting with one of our speakers, Qaiser, and he asked us all to smile so that he could take a screenshot. So guys, everyone who's with the camera, just make it pretty.
All right.
Qaiser, we're ready. Okay, thanks everyone. I think it's good now. So Rebecca, are there any more questions left that we can answer?
There's one to me. I don't There's one, but I didn't see the question from Nina.
Yeah, of course, Rudy, but please make it not a very long answer.
No, I didn't see the question. That's interesting. So I see this is a question to Valia. That's me. But I didn't see the question. Where is it?
So maybe someone just said that they had a question but didn't put it. It's a very common thing that someone says, "Can I ask a question?" and then nothing happens. So any other questions?
Or he sent this to somebody else?
Probably as well.
So I've got a question. Qaiser asked, do we have any solutions to fight the unemployment of youth?
Another economic question.
That is all I've got. That is all I can see on the chat.
Okay, I think that actually that's it. Thank you very much for everyone. Thank you, like a huge thank you to Rebecca who was moderating it. We had a very long list of speakers and an even more longer list of audience. I had a really good time with you all today. I hope you did too. The recording will be published in our social media accounts. Let's all stay safe, stay home, and hope for the better, that the pandemic will be over soon and we will get back to our normal lives.
Thank you for joining, guys. And thank you for being here.
Okay, have a good day, everyone. Thanks once again and goodbye.
Bye. Stay safe in the UK.